Take a slow, deep breath. Go ahead right now. Typical stress management, right? You've been told this helps regulate your nervous system and brings you back to baseline, which it does to a point, as do visualization, progressive relaxation, guided imagery, cognitive reframing, and so on. They work. There's good evidence behind each of them, and they do help people. But as a practicing psychiatrist and someone who's trained in Aikido for the last 25 years, I need to point something out. These techniques are hard to do when you really need them. When serious stress hits, reaching for a technique isn't so easy, even if you've practiced it a lot. But what if I told you that Aikido, with roots that go back in the Eastern martial arts for centuries, all of which existed long before anyone thought of the term nervous system regulation. What if I told you this tradition had a more fundamental solution? Not a technique that you reach for when you're already overwhelmed and can't think straight. A quality that you develop so that stress feels less threatening. That's what I'd like to talk to you about today. I'm Dr. Stephen Reidbord, a longtime psychiatrist and psychiatric educator, and also a longtime student of Aikido. Actually, at the time I'm making this video, I'm in the process of advancing to third-degree black belt, or Sandan. And this is More Than Meds, where I talk about psychotherapy and psychologically informed psychiatry. Common tools for stress management, or nervous system regulation, if you want to use that language, are fundamentally good. Slow, deep breathing has a genuine calming effect. You can really feel the effect it has on your physiology. Mindfulness practice means staying focused in the present moment, not fearfully focusing on the future or ruminating about the past. There's decades of research behind it. Guided imagery or visualization can put your mind in a calmer place. And cognitive reframing, deliberately reinterpreting a stressor, like seeing a challenge as an opportunity and not a threat, that can genuinely reduce the amount of stress that you register. I'm not dismissing any of these, they really do work. But these techniques all share a structural problem. These are things that you do. They're all interventions that you apply. You have to remember to use them, and then you have to actually use them. And that requires deliberate intentional effort. And here's the problem, that deliberate intentional effort is very hard to do when you're really stressed. The moments when you most need these techniques are exactly the moments when it's hardest to make intentional efforts. Think about what this actually looks like. If you're a little anxious or a little stressed, it's not too intense or severe, you can probably remember to breathe deeply, to visualize a peaceful scene, to choose a more charitable interpretation of the situation. But what if the stress is severe? When someone confronts you unexpectedly and your immediate reaction is flight or fight, to push back hard or to go silent, in that moment, the intentional, deliberate act of deep breathing or visualization, it's hard to access. Did you ever try to meditate your way through a genuine crisis? This isn't a personal failing, it's a property of how stress works. When we're suddenly overwhelmed, our capacity for deliberate, intentional effort narrows. We get tunnel vision. The tools that we practiced in calm moments become hard or impossible to access. That's the gap I want to talk about, and it's the gap that Eastern martial arts, culminating in Aikido, have spent centuries learning how to manage. Aikido is a modern Japanese martial art. It's only about 100 years old, but it's based in Eastern martial arts traditions that go back centuries. Aikido borrows physical moves from jiu-jitsu and from samurai sword fighting, but it's unique in its nonviolent philosophy. Its founder, Morihei Ueshiba, was influenced by Japanese spiritual traditions, and his core insight was the true mastery in conflict didn't depend on how strong or fast you are, and doesn't depend on tricky techniques. It comes from a quality of being that allows you to move with the energy of the attack, to connect with it rather than fighting fire with fire or retreating. That quality of being is called being centered, being grounded, being settled in your mind and body and spirit, being present and unshaken, not being swept away by the situation, having a kind of anchor of solidity within you, and positioning yourself at the center of whatever's happening around you. Here's what makes this different from standard stress management. In Aikido, you're not practicing being centered and grounded by yourself in a quiet room. You're working on it while someone's coming at you. Your training partner is attacking you. People argue online about how realistically hostile and vicious these attacks are in Aikido. Some say they're not serious enough to be a test of how Aikido compares to other martial arts. But for our purposes here, it truly doesn't matter. There's real physical pressure when someone pushes or grabs or takes a swing at you. There's something at stake. And the art of the martial art of Aikido is whether you can stay settled and open to that pressure. What does staying centered and grounded, settled and open feel like? It's not emptiness or unawareness. Actually, it's the opposite. A kind of aware stillness. You're completely present to what's happening around you. You're in the moment, not worrying about what's to come or regretting what's already happened. You're exactly here, and from that place you can do what in Aikido is called blending, or in Japanese Aiki, where the word Aikido comes from. Joining and harmonizing with the energy of the attack, and then redirecting it rather than fighting it. This is a trained quality. It's a state of mind. It's not a technique that you apply. We don't say, now's the time I'm going to blend. It's not something that you decide to do at a particular point in time. It's something you develop through consistent practice over time. It becomes not something you do, but really a way that you are. That's the distinction I'd want you to hold on to, because it changes the way we look at stress. Psychologists have a name for what this feels like from the inside. Mihaly Csikszentmihalyi, whose name is very hard to say, was a psychologist who spent much of his career studying flow, the flow state. It's a state of complete engagement where self-consciousness falls away, and the person is fully conscious to what's happening moment by moment, fully present as it shifts and unfolds. This isn't mysterious. You've felt it yourself if you've ever lost yourself in the flow of skiing or cycling or playing music. Athletes call this being in the zone. Musicians call it being in the groove, or they say the music plays itself. What Csikszentmihalyi found is that flow doesn't result from trying harder. You can't will your way into it. What you can do is cultivate the inner conditions that make it more available. Experienced Aikido practitioners know this flow state very well. At a certain level of training, you stop doing techniques and start responding spontaneously. The attack comes and something appropriate arises. It doesn't feel like a decision. There's a Japanese term for this, takamusu aiki, the spontaneous creation of form. You're simply present to what's happening, and the response moves through you. The flow state in Aikido is not an absence of skill. It's the integration of skill into a way of being present. And that matters in a big way for what I want to say about stress management, which I'll get right back to. If you're finding this useful, this would be a good moment to hit the like button and to subscribe if you have not already. It helps me reach people who might benefit from these ideas. Now let me tell you what all this has to do with psychotherapy, because the parallel is closer than you might expect. In the tradition of psychotherapy that I work in and that I teach, psychodynamic psychotherapy, we talk a lot about the therapist's inner state as an instrument of treatment. The therapeutic relationship, not concrete techniques, are a big part of what's healing. And what I've seen over many years is that effective psychotherapists meet very intense emotional material, rage, deep sadness, despair, suicidal feelings, with the psychotherapy equivalent of Aikido blending. The therapist stays present and settled and grounded and receives the emotional energy with openness, moving with it, blending in a sense, rather than trying to shut it down, opposing it, making it go away, or retreating, and without losing their own center in the process. In psychotherapy, we have a special name for this. We call it attunement. But note, attunement is not a technique. The therapist does not say, it's time to be attuned now. I'm going to attune. It's a state of being. The therapist's own nervous system needs to be regulated, settled, centered, grounded, so that it can be genuinely present with what's in the room without getting swept away by it, without losing their center. Therapists who are poorly regulated, especially beginning therapists, tend to do what beginning Aikido students do. They meet force with force, or they retreat from it. They fight the patient's resistance instead of engaging with it. They get flooded when the patient is flooded, or they fall silent when the patient gets angry. And the therapeutic connection breaks just when it's most needed. A well-regulated therapist, a grounded, centered therapist, remains present with the patient's distress without amplifying it and without fleeing. That's a healing therapeutic relationship. It's not a technique they applied. It's a quality of presence that they bring into the room. Experienced therapists working from this place of attunement recognize something similar to what I just described in Aikido. Not executing a plan, not deciding what to say next, but being fully present to what's happening in the room moment by moment and responding from that presence. It's the psychotherapy version of Takamusu Aiki, the spontaneous creation of form. Insights arise that weren't anticipated. It's creative. The session moves somewhere that neither person expected it to go. There's a flow to it. If you've ever been in a therapy session where something shifted in a positive way, in a way that surprised both of you, it may have emerged from a flow state, from being fully present in the moment, not from a technique that was applied. So here's the problem with most stress management advice. It assumes the answer is better doing, more deliberate deep breathing, more consistent mindfulness, a more reliable way to reframe a thought. Do that. But what Aikido points to, and what depth psychotherapy has been saying for decades in its own language, is that the goal isn't to get better at the doing. It's to develop a different way of being. I have an earlier video where I talk about this distinction at some length, specifically in the context of training psychiatry residents to do depth psychotherapy. That video's right there. Medical training is almost entirely about doing, making a diagnosis, forming a treatment plan, doing an intervention. And then these new doctors who are specializing in psychiatry and they're just beginning to learn about psychotherapy, they discovered that the entire orientation shifts. It goes from what do I do to how do I be? There's even a line I use in some of my seminars. Don't just do something, sit there. Now, what does it actually mean to be rather than do in relation to stress? This comes back to the flow state that I described. In flow, you're not doing techniques. You're not deciding to apply something. You're fully present, fully responsive, and what emerges from that state of being. The doing happens, but not from a decision to execute a skill. You can't decide to enter a flow state. You can't force it. What you can do is cultivate the inner conditions, the centering, the settling, the grounding, that make it more available. In a typical stressed moment, the usual advice says to breathe slowly, reframe the situation, do a body scan meditation. But you're not in a flow state. You're reactive, you're narrowed, you have tunnel vision. And the technique, even if you know it well, requires you to override your natural reaction, your immediate impulse, and requires you to impose something that you learned previously in a calm state. What would it look like instead if you had developed a quality of being, grounded or centered, that you were already in when you encountered the stressor? It's not that you'd feel nothing. In Aikido, we feel the attack when it comes in, and as therapists, we feel the patient's distress. But the experience lands differently when you're grounded. You're not swept away. There's room for something suitable to arise. Not a technique that you reached for, but a response that emerges naturally from this particular situation, from this moment as it actually is. Stress management techniques are genuinely useful, but they're usually framed as something that you do. Aikido and depth psychotherapy both point instead toward a way of being. The practical implication is that these practices aren't really tools easily deployed in moments of intense stress. Instead, they help you develop over time a different relationship to your own inner state, so that when difficulty arises, you're already inhabiting a kind of presence that can receive it without being overwhelmed. The goal is a state of presence, not technique. The techniques are, in a sense, a practice to enter a state of being that ultimately doesn't need them. That's what we say in Aikido. We learn these moves over and over again over many years, and then eventually you forget all the moves and just let the response flow naturally from the state you're in. You let the flow with you in the center determine what happens. What Aikido and the Eastern martial arts have known for centuries, and what depth psychotherapy, like psychodynamic therapy, has known for decades and has expressed in its own language, is that genuine nervous system regulation or stress management isn't mainly about what you do in the face of intense stress. It's about what you've cultivated beforehand, being centered, being grounded, being settled, being open to what you're experiencing. The capacity to stay present under pressure, familiarity with the flow state of engagement in the here and now. I'm curious whether this resonates with your own experience. Have you noticed the limits I'm describing? That standard stress management techniques are hard to apply in the face of really intense stress? Let me know in the comments. I read every one of them, and if you pose a good question, I'll give you a good answer. If you want to go deeper on being versus doing, I have a video that I think pairs very well with this one. Please like this video, but only if you really like it, and please subscribe if you haven't already. I release new videos regularly on psychotherapy and psychologically informed psychiatry, and maybe some that link these to Aikido as well. Thanks, and I'll see you next time.